interested to see how it plays out.
Okay, let's call this meeting to order. Sorry I'm late. So, our first order of business is approval of minutes. So let's take a few minutes and review those.
I'm prepared to make a motion to approve the minutes of the last meeting.
Second.
All in favor?
Aye.
Opposed, same. Okay. Minutes are approved. Division reports, doesn't look like we have anyone here to discuss them, so it's on us to read that.
Sarah, I don't know how much information you know on these. I mean,
Some.
all right.
Excellent.
So what is the plan about the FSSA call center? I mean, it's closed right now, people are working from home.
And they are totally, the dividers between the cubicle dividers are being disposed of because they were cloth and new ones are being brought in, the carpet's being ripped out. They're completely renovating the building. And then they're putting some kind of process in place to kind of screen the employees as they bring them back in to make sure it doesn't reintroduce the problem.
Do we have any timeline on when that might be completed?
No. Most of the employees really like working from home after COVID.
Well, one of the concerns that has been brought to my attention is with the lifting of the public health emergency and a lot of things are changing, the automatic renewal for Medicaid, and like our clinic is very much dependent on it, but that is coming to an end. And so people are concerned about their ability to process their paperwork or lose their eligibility for Medicaid. So I'm very curious how this FSSA call center is going to affect that.
They are working from home. There. So there shouldn't be much of a hiccup in the workflow.
I'm also curious what we're doing to get rid of the bats at Taylor University. Or somebody using a tennis racket and going after them?
We're educating and leaving it up to Taylor to get rid of the bats. We are responsible for testing, not eradication.
And all have tested negative to this.
Correct.
So, Madam Chairperson, I would recommend the approval of the environmental. Do you want them all at once or separately?
I'm still reading through.
We typically do them all.
Okay, all right. Then I shall wait.
Skim through these. Is there anything you think we should pay special attention to in these reports?
The VaxCare is the new vaccination billing program that the nurses started. Pretty excited. It's going to take a lot off of our receptionist's plate because she's receptionist, scheduling, billing. It'll help her tremendously, and it seemed to implement very smoothly.
So user-friendly and. Okay.
And
Is it
alleviates a
easier
lot
than
of.
for record keeping as well?
Pardon?
Is it easier than for record keeping as well?
It is
Does
for
it do the record?
The ordering of the vaccination, the inventory, it just takes a lot of that off of our nurses even. You just schedule appointments, VaxCare sees the appointment, sends the vaccine, and it
Nice.
takes, yeah.
So
Yeah.
basically we'll have almost zero inventory responsibility.
Yes, it was nerve-wracking because it sounded too good to be true, but it's playing out to be too good to be true, so we'll see.
Awesome. Okay, well, I will entertain a motion now.
I move that we accept all the reports from foods, environmental, nursing, vital records.
Second. All opposed, or all in favor?
Aye.
All opposed? All right. We will call it good. Okay, so that over there. Old business. Let's talk about old business.
So the commissioners asked several months ago for each department in the building to create a continuation of operations plan. This is the health department's. It allows for a line of succession in decision-making. It kind of lays out, if most of us got hit by a bus, to the people that are left, kind of what divisions need to be operating and what access they need to make that happen. It lays out our plan for relocation, the plan for how we continue to operate in a different location, the plan to come back when things settle and get repaired. Just, I can go through all the pages if you would like, or I don't know how much information you want me to share.
Did you guys create this?
Yeah, we started by reading somebody else's and
then
took their
modified
template,
it
yes,
for our own
yeah.
specific needs?
Modified it a lot. It was a department with, it was a health department with twice as many divisions as we have, so you had to cut a lot out of it.
Sure. Plus, you had to identify local locations to move to and so forth. And have all of those local locations agreed to?
Yes, it's,
okay.
the one that we've chosen is where EMS is located, EMA is located.
All right.
And the county owns.
In a county-owned building, yes.
Okay, perfect. Great, excellent. So I noticed there are signature pages in here.
So we can adopt it now and have it signed whenever. We can adopt it, you can sign it as the.
Okay. Yeah, I just wondered if there was a timeline on this, if we were expected to read and approve it this meeting, or?
No, I just have to present it to the commissioners and then provide a copy to EMA when it's approved.
Okay, all right. Do you guys have a feeling about how much time it will take us to review and approve this document, or have you guys already done it?
I've already done it.
I mean,
It was
I
on-
got it last
yeah.
time and I read it, so I think it's fine. I move that we approve the continuity of operations plan.
Perfect.
I'll second that.
Okay. All in favor?
Aye.
All opposed, same? Okay. So I guess I will sign it.
I will update the front page with today's date before I send it to the commissioner.
Of course, the pen decides to die halfway through my signature.
Keep that one.
Thank you. Okay, and then I believe I have a copy from last time in my folder, so do you want me to
I'll just take the signature.
give the signature?
I was telling them before you got here, when I was reading over it Friday to just refresh my memory, I found 2 tiny typos. So it's changed in this one.
Okay.
Thank you very much.
There you go. Okey doke. And then the big thing, the Governor's Public Health Commission Fund. I confess I have not had much time to look over this.
So this is moving through the legislature. Do you want to speak on this a little bit?
Right now, it started off in the Senate bill 4, and now it's moved to the House, and I've not been able to see it in the House. changes that have been going on with this.
Mhm.
If I remember correctly, they reduced the amounts that they initially had been talking about before it left the Senate, went to the House, so, we're still really up in limbo about where this is gonna go. So hopefully we're just, have to wait and see what the House does with it.
So I know there was some discussion about creating a committee to manage this on our end, I guess. And I distinctly remember volunteering for that committee.
Okay, and I think Sarah
I
did
don't
as
know.
As
well.
well, yeah.
Okay,
Pardon?
Sarah did as well.
Mhm.
Sarah did as well.
Mhm.
Okay, great. So at this point, we need to set a date for that committee to meet.
Right, who else was, or who's gonna make up the committee? I think that was part of what we were gonna talk about.
Oh,
right?
yeah.
Well, I would like for our public health nurse to be a participant and myself, Dr. Rudolph probably should be part of it. I don't know that it needs to be a large committee, at least not in the beginning. It's more, we have a workbook here. It's more of sitting down and figuring out what we're currently doing, what staff we're using to do that, what we will have, what additional staffing services we will need to have to meet those core services, because there are standards that are set out. If you accept the money, you have to meet these core standards. They're currently developing the KPIs so that we can assure that we're doing that. So it's just to sit down and go through the workbook, figure out what we have, what we will need, and then what we would want, what programs we would want to try to implement or just help fund. We don't have to do all of these ourselves. If there's an organization or a group out there doing a service perfectly, we can just help fund them. There is accountability on their part, but we don't have to do it all ourselves. We just have to assure that it's done in our county. So part of it is just brainstorming to figure out what do we want to try to do ourselves and what do we want to just help somebody else that's already doing it.
How would you determine, like, helping to fund the current program that someone's doing that meets those standards? How do you determine, you know what I mean? Like, is it based on their budget, how much we are gonna help fund, or?
Probably, I think in Miami County, you said you're gonna set up kind of like a mini grant
Yeah.
process.
Probably more like a foundation committee, so that if we reach out and an organization wants us to help fund what they're doing and it meets the KPIs, then we would bring that before that committee and approve or disapprove it. And the idea that I had was that you would have community leaders on there, and not just board members, not just health department people. And hopefully it'd be people who know the needs of the county and are familiar, have good contacts within the county. So that's one of the things we're tossing around doing. And if, you know, I guess you can go so far as saying you can either say, yeah, we'll give you all the money or we'll give you part of the money that you're asking for. But then when they do that, like Tara said, there is accountability on their end.
And then that attributes to accountability on the health department.
Well,
Correct.
we'll
You know
have
what I
that
mean? That's
anyway.
gonna take some,
Yeah.
another employee probably just to
Right,
deal with just this, you know,
right,
that whole aspect.
exactly.
When we were talking about having the committee being kind of small at the beginning, I know that you had discussion, or at least there was discussion about the other entities that would have some expertise or meeting some of these health issues and goals. When would those people then, like if you were talking, you know, if, I remember you mentioning like the foundation, so if there were, someone that the community foundation that wanted to be on this committee, for example, or I spoke with a couple of people at Bridges to Health, again, trying to, so I'm really wanting to not see us not duplicate things. That's what I'm.
Sure.
Correct.
If we're gonna go through all of this, I'd like for it to actually have a.
So for me, our next health board meeting is the third Monday in May, whatever day that is. We will know by then
Yeah.
what the funding amount will be.
Okay.
Well, they're supposed to have it decided, I mean, the session ends April 29th. So they have to have a decision. I mean, we have to have solid numbers by early May. So maybe at the next health board meeting, we decide that. You know, if they cut it back as much as was proposed when it went out of one body into the other, there's a lot of government lingo here that I struggle with. It was a huge proposed cut in the funding amount. So it would make a drastic difference. There may not be any money to have to give away by the time we hire a school liaison and a third environmental health specialist. There just may not be much to be concerned about. So I would rather wait until we know for sure what the funding is before we go that far. I'm happy to do this workbook and kind of figure out where we're lacking and what we would need to meet the KPIs. But I
think this is really just all very much up in the air right now. I think it's hard to do anything or hard to move forward on anything connected with this until we know what we're actually working with. So I think once it gets through the House, hopefully they won't table it until next year. Then I think that's when the real work's going to start.
I think the small team could figure out what we need right here and what that dollar amount would encompass. And then if we find out there's excess, we can bring together a bigger team to figure out what we do outside of here with it.
I think
Does that make
that's,
sense?
yep, that's what I
Now, I think, if I remember correctly, you sent out an email after our last meeting for the KPIs based on other years or?
Well, it was the ones that had been developed to date. They're meeting every other Friday to develop KPIs for each core service.
Because obviously, I think it would be important to know what are the metrics
Correct.
whenever we meet in May in terms of, when it comes to how much you allocate for this and this and this, I'm happy to let other people figure out the dollar amounts. As a physician, though, what I am concerned is what are the specific clinical indicators that we're trying to accomplish. And so that's why we're very interested in seeing what that KPI is.
I will send them as I get them.
Okay.
I don't think I've received another one since the last health board meeting.
I mean, it's interesting. Were you the one who put this together, or who put this together?
I took a template and then put our information in there.
But I think I commend you for this. This is the kind of information that really, especially, and I know we've talked about this in the meeting before, where Rankin County sits in relationship to the rest of the state. This is information that not only we need to know, but it really, particularly because I know even though I don't like to deal with money, but I know when it comes to talking to money, that's where the controversies usually come up. So this kind of information needs to be plastered everywhere. I mean, it needs to be every counselor's constituent, on the newspaper, all of that.
I did send this to every commissioner and councilman.
And it's my understanding that they are having separate meetings with the state for the commissioners and the councilmen.
Okay.
Because I ran into our commissioner representative at a store, and she was talking about how great the meeting was about this. So evidently they're having separate informational meetings.
Ultimately, though, it's the county council that
I believe the commissioners will approve it because one of our commissioners was on the Public Health Commission. And I have received a call from one of our councilmen talking about the video that went viral of Commissioner Birdsley and stating that this was just a big government takeover of your health rights in your community and questioning that. And the state really, I mean, they are creating KPIs, but they're not coming in and taking over anything. They're saying, if you want this money, you have to provide this service. There's just skepticism. And I've also been questioned, okay, so we accept this money for 5 years, what happens when they cut it, when they take the money away?
I'll give you I've been involved in federal grants when I was working in Kenya as a missionary. That's when they rolled out PEPFAR, $5 billion and being in Kenya. And I asked that question in a meeting that involved Kenyans and representatives from Walter Reed and the federal government. I'll never forget what one Kenyan said. It says, when you have nothing to eat, and when somebody provides you food, you eat that food, and then you worry tomorrow about what the next meal's coming from. So I mean, obviously, that's a legitimate question, but the thing about, you deal with the problems that you're having at this time, and you use the money accordingly. And if they decide they're not going to do this anymore, well, it was a great ride while it happened, but look how we made a difference in the lives of the people during that period of time.
So you would like to come to our council meeting and present that thought process, right?
I'm open depending on when and where it is.
So
Usually
Wednesday evening, I'll let you know.
And so on that, the 20%, did you get any clarification on?
Yes,
is.
yeah, I got clarified.
Yeah, so it is 20% of the reward amount.
That the
That is-
council commits to
Correct.
for 5 years?
Right.
Right.
But that would still save them, I mean, our budget right for this year is 648,000, I believe. Sorry, 638,000. That would still save them 408,000, oh no, I'm sorry. That would save them 230,000 a year that they have to spend. I mean, the hope on the state's part is that they don't cut that. They continue to put the same amount in that they always have. But they're only required to put in 20% of the grant. It's not a grant. They keep saying it's not a grant, of the funding amount.
So you're saying that right now, if the budget's 638,000, they're only committing to 408,000,
If they
But they already
accept the funding.
pay that. So
Pardon?
there shouldn't be any extra funding from the council, from the county?
Right, so in the first year, they would still have to pay the 638,000.
Right.
In year 2 through 5, they would only have to pay 20% of the 2.04 million.
So now the health department budget becomes the 2.04 million, and the county just has to commit to 20%.
408,000.
Okay.
Right, right.
Clear as mud.
I do finally have it clear in my brain. I hope I'm
So,
not explaining it.
But there's a possibility that they could cut this amount back to the point that would essentially make require the county to put in, I mean, it's already a much lesser amount, but it could be cut back to,
Well, and some of the proposals that went from one to the other did make it a 25-75 versus 80-20.
okay,
So-
yeah.
So
So I guess it would be my wish that if they do cut back that total amount, that they also raise the percentage so that we don't end up with less than what we had.
right. Well, and we can, I mean, the county can opt out. They don't have to accept this funding.
Because you're right, if they get used to paying the less amount,
Yeah,
it's really hard to get
to
that,
get more,
that money.
yeah.
Believe me, I know.
Yeah.
Right,
So-
and that was their point. It's not only do we have these additional employees that we've hired in,
Mhm.
if they cut the funding after the 5th year,
Right.
but now we have to come up with this 240,000 that we were saving every year.
Well, and you never
So-
know what property
Unless we can
taxes are
convince
coming
the
in. I
council
mean,
to maintain our
you just
current
never
level of
know.
funding, which would be
That's right.
I think that would certainly be my recommendation, again, because there's no guarantee after 5 years what, plus again, it allows us to do more. So, oh well.
I need these guys to come do my council presentation.
So when will this be presented to the council for their approval?
Not until we have more answers.
Okay.
Budget time.
Okay, and are we the ones that make the decision about when it gets presented to council?
No, so typically, county budgets, the initial paperwork has to be submitted in June, towards the end of June,
Okay,
and the budget hearings are in August. So what the state is recommending is that we submit 2 budgets, one for our regular, let's pretend like this never came along, and then a second one with all of this funding in it. I know, it's a lot of work.
Who's the president of the council?
Shane Middlesworth.
Okay, that's right. I mean, it might be beneficial to, just, because rather than wait and like spring it on them to have it,
Oh, I have emailed it to all of them.
yeah.
And so the
Hopefully
state
they're
has
paying
sent them letters. In fact, when I emailed them, I sent them a copy of the letter from Dr. Box, kind of as a, hey, remember this letter you got? Well, here's some more
Have they given
information.
you any
Just the one,
feedback?
just the one. So. The current auditor is the one who brought up they do this all the time, they give us extra money and then they take it away and leave us in a lurch, so.
Unfortunately, that does seem to have been the situation.
So.
okay. So what decisions do we need to make today, if any?
Do we want to get a team together to just go through this assessment?
I think we should.
Sarah's still on. Sarah, are you still here?
She was supposed to be boarding a plane about now, so.
No, I thought she was.
Yeah.
Before she went, okay.
So, yeah, well, if it's me, Sarah, one of our nursing staff, Tara, Dr. Rudolph, and that's going to be our small group, our initial evaluation group. Then again, I think we probably need to, could you send an email to everybody on that list and propose some dates where we could meet?
Do we want evenings or daytime?
I prefer evenings, but.
Okay.
Do you need a motion, from this board for those names to be on the initial?
Anybody
Task
else wanna
force.
be on it?
I'll do it.
Okay. You know why I like that? Because Kathy had worked at a health department.
Yeah.
So, yeah,
You know how,
thank you. Okay. Kathy.
you know the nuts and bolts.
Yes, I do.
That's good. All right, excellent.
So that's Denise, Kathy, Sarah, Tara, which nurse?
Dr. Jane Hampton.
Dr. Rudolph. So I'd like to make a motion that this board appoints that task force to explore this. Now, one other thing, I'll make that motion, but I want to clarify one point. I remember one time when there was a task force, this goes back several years ago when we were looking at changing the county health board. If you have more than 3 health board members on a committee, then it runs into a violation of the Sunshine Act or whatever?
That's a question for Jane.
I don't know.
Do you think I can call him?
Because otherwise it looks like some sort of, some people might accuse you of some sort of, quote, conspiracy. or
Private
whatever.
conspiracy.
Because I vaguely remember, but I think,
But if it's an in-house, interdepartment committee, it has to be us.
And we're not making any decisions.
Right, we're not
Just
making
having-
decisions.
I would think maybe the committee would be that.
I
No,
remember
it's a good thought
David
process.
saying something about the numbers, that it does raise eyebrows, but when and this goes back at the time when we were reviewing Dr. Kennedy, and then we were looking at actually creating a review process for the county health officer. But if I remember correctly, there were 3 of us on the board at that time. That was myself, Dr. Lady, and the other veterinarian.
Dr. Ratliff?
Yes, Dr. Ratliff. So there was 3, and I think he said that was okay. So it was just Kathy, Denise, and Sarah, I think will be okay.
He didn't respond, so he must not be available. Okay.
Because there was no more than that, so.
Right.
But anyway, I'll make that motion. And if you find out something differently, then
I'm gonna put pending.
legal counsel.
Legal advice. How's that?
Who did you text, David?
Yeah.
Yeah.
He said he could be available by phone, but to text him first.
Right.
Pending legal advice. Okay.
Second.
All in favor?
Aye.
Opposed, same. Motion carries.
Any member of the public have anything they want to say?
Where is everybody?
It'll be a bigger issue if we were actually talking about money. Then everybody would be.
Yeah, sure, for sure. Any new business? Okay, public comments. There's no public, two comments.
No, okay.
Okay,
Senator Rudolph, do you have anything that you would like to report to us?
No, not really.
Okay.
I'm just very impressed with her.
Oh, thank you.
Nice.
She does a good job.
amen.
Great job.
All right. Then I will call for a motion to adjourn.
So moved.
Second.
Okay.
Aye.
Adjourn.
Adjourn at what time? 5:37.
Someone.